Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You will hear part of a consultation between a psychologist and a patient called Mr. Danny. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi there, Mr. Danny. Your GP has referred you to me to discuss your recent diagnosis of tuberculosis TB. How have you been feeling about everything?
Well, it's been a lot to process, to be honest. I'm still trying to understand how I got it and how long it will take to recover. On top of that, the medication has been making me feel off, like just really tired and nauseous at times.
That's completely understandable, Mr. Danny. TB treatment can feel overwhelming, especially at first. Let's go back a bit. When did you start your treatment?
I started about 2 weeks ago. The doctor put me on a combination of medications, rifampicin, isoniazid, ethambutol, and pyrazinamide.
That's the standard first-line treatment. Are you taking all 4 medications daily?
Yes, I am. The doctor explained that it's important to stick to it, but I have to admit, I've been struggling. The side effects are tough, especially the nausea and the weird orange color in my urine.
Yes, that's a common side effect of rifampicin, and it can be alarming if you're not prepared for it. The nausea. Are you noticing if it's worse at certain times of the day or with certain foods?
Definitely in the mornings and sometimes after I eat something heavy.
Okay. Sometimes taking the medication with a light meal or switching the timing can help. We can discuss that with your doctor. Have you noticed any other side effects, like vision changes or numbness in your hands or feet?
No, nothing like that so far.
That's good to hear. Now, aside from the physical symptoms, how are you coping mentally and emotionally?
I'm finding it hard, to be honest. Knowing that TB is contagious has made me isolate myself from my family. I don't want to risk passing it on, especially to my kids. It's lonely, and I feel like I'm missing out on so much.
I can imagine that must be very difficult. It's worth noting that after a few weeks on treatment, the risk of transmitting TB significantly decreases, provided you're taking your medications correctly. Have your doctors shared any updates about that?
Yes, they said something like that, but I still feel guilty and anxious about being around others.
Those feelings are very natural, but as you adhere to the treatment, you'll regain confidence in interacting with others safely. In the meantime, are you finding ways to stay connected, even if remotely?
A bit. I've been video calling my kids and reading with them at bedtime. It's not the same, but it helps.
That's wonderful, Mr. Danny. Maintaining those connections is so important. Have you been able to rest and take care of yourself?
I'm trying. The fatigue is tough though. Even small tasks like making lunch feel exhausting some days.
Fatigue is a common symptom of both TB and its treatment. It's okay to pace yourself and prioritize rest. It might help to break tasks into smaller, manageable steps.
That's a good idea. I tend to push myself too hard sometimes.
It's a balance, isn't it? On that note, have you been able to go outside for fresh air or short walks?
Not yet. I feel like I don't have the energy, and I'm also worried about running into someone I know.
Understandable, but even a few minutes of fresh air in a quiet spot can boost your mood and energy levels. When you're ready, that might be something to try.
I'll think about it.
Good. And remember, you don't have to do this alone. Support is available. Have you looked into any local or online TB support groups?
Not yet. I wasn't sure if that would help.
Many people find it comforting to connect with others who understand what they're going through. It's something to consider.
I will. Thanks for mentioning it.
Of course. It sounds like you're doing your best to stay strong, Mr. Danny, and that's commendable. Let's keep monitoring how you're feeling, both physically and emotionally, and we'll work through this together.
Thank you. I appreciate it.
You're welcome. Remember, recovery from TB is a journey, and every step you take is progress. Let's schedule a follow-up soon to check in.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mrs. Jackson. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Jackson. I'm Dr. Patel. It's nice to meet you.
Good morning, Doctor. Nice to meet you too.
How can I help you today?
Well, I've been feeling really unwell for the past week or so. I'm tired all the time, my ankles are swollen, and I don't seem to be passing as much urine as usual.
I see. Thank you for sharing that. Let's start with your symptoms. You mentioned feeling tired. How severe is the fatigue? Is it affecting your daily activities?
Oh yes. It's hard to even get through simple tasks like cooking or cleaning. I feel completely drained most of the time.
I understand. And about the swelling in your ankles, when did you first notice it?
Maybe 5 or 6 days ago. It's gotten worse since then, especially in the evenings.
Does the swelling go down overnight or stay the same?
It's a bit better in the mornings, but it never really goes away.
And you mentioned reduced urine output. Has it been significantly less than usual?
Yes, much less. I've been trying to drink plenty of water, but it doesn't seem to make a difference.
That's important to know. Have you noticed any changes in the color of your urine, darker than usual, perhaps?
Yes, it's been darker, almost tea-colored.
Have you had any pain or discomfort when passing urine?
No pain, but it feels like I'm just not able to empty my bladder completely.
I see. Now, let's talk about any other symptoms. Have you experienced nausea, vomiting, or loss of appetite?
Yes, I've been feeling a bit nauseous, and I've barely had an appetite for the past few days.
Okay. And what about shortness of breath?
Actually, yes. I get out of breath easily, even when just walking a short distance.
Thank you for sharing all that, Mrs. Jackson. Let's go over your medical history briefly. Have you ever had any kidney-related problems before?
Not that I know of, but I do have high blood pressure, and I take medication for it.
I see. Do you remember the name of the medication?
It's called lisinopril.
Lisinopril, okay. And have you had any recent illnesses, fevers, or infections?
I had a bad cold about 2 weeks ago, but nothing else.
Thank you. Have you taken any over-the-counter painkillers or other medications recently?
Yes, I took ibuprofen for a few days because of a headache.
That's helpful to know. Have you noticed any changes in your weight recently?
I've gained a few pounds, but I think it's mostly the swelling.
That makes sense. Based on what you've told me, it sounds like your symptoms could be related to your kidneys. There are a few possibilities we need to investigate, including acute kidney failure.
Kidney failure? That sounds serious.
It can be, but the good news is that if it's caught early, it's often treatable. Acute kidney failure means your kidneys aren't working as well as they should, which can happen for several reasons. It might be related to dehydration, certain medications, or even a recent illness like the cold you mentioned.
Oh, I see. What will we do to check?
We'll start with some blood tests to look at your kidney function, specifically your creatinine and blood urea nitrogen levels. We'll also do a urine test to check for any signs of infection or abnormalities.
That sounds good.
In the meantime, I'd like you to avoid taking ibuprofen or any other non-steroidal anti-inflammatory drugs, as they can sometimes strain the kidneys. Also, try to stay hydrated but don't overdo it, just drink enough to stay comfortable.
Okay, I'll make sure to do that.
Excellent. Once we have the test results, we'll discuss next steps. Depending on the cause, treatment might include adjusting your medications, managing your blood pressure, or addressing any underlying issues like dehydration or an infection.
Thank you, Doctor. I feel a bit less worried now.
I'm glad to hear that. We'll work through this together. Let's get started on those tests today, and I'll follow up with you once we have the results.
Thank you.
You're very welcome. Take care, Mrs. Jackson.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a dermatologist addressing a concern. Now read the question.
Thank you for bringing up your concerns about aging skin. While cosmetic treatments like chemical peels or fillers can help reduce wrinkles and fine lines, that doesn't seem to explain the irritation you're experiencing. Let's consider another factor. Retinoids, commonly prescribed to improve skin texture and reduce signs of aging, can cause dryness, peeling and redness, especially when first introduced or used incorrectly. Based on your description, this is likely the cause of the irritation. Ensuring proper usage and hydration can help manage these side effects.
Now look at question 26. You hear a discussion about a recent diagnosis. Now read the question.
Be osteoarthritis or...
Well, it's possible, but Sam is young, so yeah, it's unlikely. What do you think? What else could it be? What's common in younger patients?
They have chronic joint pain, but it's affecting multiple joints.
Right, something much more common than that.
Autoimmune,
Yeah,
juvenile arthritis, lupus.
could be, but there are no significant systemic symptoms pointing to lupus or signs of inflammation in juvenile arthritis. What else could lead to joint discomfort in someone young?
Maybe repetitive movements or strain.
Exactly.
Now look at question 27. You hear a trainee public health officer discussing with their mentor an uncomfortable situation they encountered while addressing health literacy challenges in a community. Now, read the question.
Could we talk about the session I had with the residents in the community hall yesterday?
Of course. Did something go wrong?
Not exactly, but it was more challenging than I expected. I had to explain why improving health literacy was so important, especially in managing chronic diseases. They seemed uninterested at first, but then they began asking complex questions about why health outcomes were still poor despite the information being available. I felt overwhelmed trying to explain without sounding defensive. It was frustrating because I started doubting my ability to connect with them and stay focused.
That's understandable. Addressing skepticism and engaging with communities can be tough, but it's part of the learning process.
Now look at question 28. You hear two therapists talking each other. Now read the question.
So, what's the aim of this role-playing exercise today?
Well, the idea is for one of us to play the role of a client and the other to be the therapist. The objective is to practice responding to challenging emotions or situations that might arise during a session.
Oh, I see. Are there specific scenarios we need to follow?
Not exactly. We're given a set of prompts that outline a situation like a client dealing with anxiety or grief, and we use them as a starting point. Then we improvise and respond naturally. Once we're done, we evaluate how effective the responses were.
Right. Sounds like it'll help us handle real-life situations more confidently. Let's begin.
Now look at question 29. You hear two doctors' discussion. Now read the question. Hey, Dr. Coleman, I have a patient here, and I'm considering imaging for chronic shoulder pain. I'd like to get your thoughts.
Sure, let's discuss. Is this the 52-year-old woman with persistent right shoulder pain?
Yes, that's the one. She's had the pain for about 8 months, and it's been gradually worsening. She reports significant discomfort when lifting objects or raising her arm above shoulder height. Physical therapy hasn't provided much improvement, and NSAIDs only offer temporary relief. Her physical exam shows limited range of motion, and her x-rays didn't reveal anything conclusive. I'm thinking about ordering an MRI to get a clearer picture.
That makes sense, especially with the duration and limited response to therapy. Given the symptoms and lack of findings on the x-rays, an MRI would be the logical next step to evaluate soft tissue structures like the rotator cuff or labrum.
Now look at question 30. You hear a nurse briefing about an issue. Now read the question.
Frequently treats patients who are particularly vulnerable to preventable illnesses due to low vaccination rates, especially in at-risk populations like the elderly and those with chronic health conditions. Starting next month, we will be launching a new vaccination awareness and outreach program. This program aims to increase awareness among patients about the importance of vaccinations. It will also involve community health workers who will provide educational sessions for patients and their families. Additionally, these workers will help train us to communicate effectively with patients about vaccination-related concerns. Any questions or feedback about this initiative or the community health workers involved should be directed to Ravi, who oversees the Health Promotion Department.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Clara Evans, a specialist in healthcare workforce well-being, discussing challenges faced by healthcare professionals and strategies for improvement. You now have 90 seconds to read questions.
My guest today is Dr. Clara Evans, a specialist in healthcare workforce well-being, here to discuss some pressing challenges faced by healthcare professionals. Dr. Evans, what are the biggest concerns for healthcare workers today?
The primary issues are burnout, compassion fatigue, and mental health challenges. Healthcare workers often face immense stress, long hours, and emotional demands, which can lead to feelings of exhaustion and detachment. Burnout is particularly widespread. It stems from the chronic stress of the job and can manifest as physical and emotional exhaustion, reduced sense of accomplishment, and feelings of cynicism. Compassion fatigue, on the other hand, happens when the emotional toll of caring for others becomes overwhelming, leaving workers feeling depleted. Together, these challenges significantly impact not only the individual, but also patient care and the healthcare system as a whole.
And what do you think causes these issues to escalate in healthcare?
Well, it's a combination of systemic and personal factors. Systemically, staffing shortages are a major contributor. When there aren't enough staff, healthcare workers take on heavier workloads, work longer hours, and have less time for recovery. Another factor is the constant exposure to suffering and death, which can take a toll over time. On a personal level, some healthcare professionals struggle with setting boundaries, saying no, or even recognizing the early signs of burnout. It's this combination of external pressures and internal responses that makes these challenges so pervasive.
What are the strategies you recommend for addressing burnout and compassion fatigue?
First and foremost, self-care is vital. It sounds simple, but prioritizing adequate sleep, physical activity, and a balanced diet can make a world of difference. Beyond that, creating boundaries between work and personal life is key. Healthcare professionals need to give themselves permission to rest and recharge. Work-life balance can also be supported by fostering a supportive workplace culture, where managers actively monitor workloads and provide opportunities for peer support. Lastly, I advocate for healthcare systems to invest in mental health resources, like counseling and resilience training, to support their teams.
Some workplaces have started adopting well-being programs. Do you think these are effective?
Absolutely, when done right. Effective well-being programs go beyond surface-level offerings like yoga classes or fitness challenges. They need to address root causes, such as staffing shortages or unrealistic productivity demands. For example, providing access to mental health services and promoting a culture of openness about mental health can be transformative. Encouraging leadership to model healthy behaviors, like taking breaks or setting boundaries, can also set a positive tone for the entire organization.
What role does leadership play in fostering a supportive environment?
Leadership is critical. Leaders set the tone for the workplace culture and can either exacerbate or alleviate stress. Leaders need to actively listen to their teams, recognize signs of burnout, and make changes to improve working conditions. Simple actions, like expressing gratitude or offering flexibility in schedules, can have a huge impact. Leaders also have the power to advocate for systemic changes, such as improving staffing levels or ensuring fair workloads.
Lastly, what advice would you give to a healthcare professional struggling right now?
My advice would be to reach out and seek support, whether it's talking to a trusted colleague, accessing counseling services, or even just sharing your struggles with someone who will listen. It's important not to go through this alone. Also, don't wait until you're at a breaking point to take action. Recognize the early signs of burnout and take steps to care for yourself. Remember, taking care of yourself is not selfish. It's necessary to continue doing the work you're so passionate about.
Extract 2. Questions 37 to 42. You hear Dr. Rio George, a neurologist at City General Hospital, discussing Huntington's disease. Now, read the questions. You now have 90 seconds to read questions.
Hello everyone. I'm Dr. Rio George, a neurologist at City General Hospital, and today I'll be discussing Huntington's disease, or HD. This is a rare but impactful genetic disorder that profoundly affects an individual's motor function, cognition, and behavior. My aim today is to give an overview of the disease, its progression, implications for families, and the clinical challenges in its management. Let's start with the basics. Huntington's disease is caused by a genetic mutation on chromosome 4, specifically an abnormal expansion of the Kagi nucleotide sequence in the HTT gene. This mutation results in the production of a faulty version of the Huntington protein, which accumulates and damages nerve cells in the brain over time. HD is inherited in an autosomal dominant pattern, meaning if one parent carries the mutation, their child has a 50% chance of inheriting it. Unfortunately, individuals who inherit the gene will inevitably develop the condition, though its onset and severity can vary. Symptoms of HD typically manifest between the ages of 30 and 50, though in some cases symptoms may appear earlier or later. The condition progresses in 3 primary domains: motor dysfunction, cognitive decline, and psychiatric symptoms. Early signs may include subtle mood changes, irritability, or unsteadiness, which are often mistaken for normal aging or stress. As the disease advances, chorea, characterized by involuntary jerky movements, becomes more pronounced, and individuals may experience difficulty walking, speaking, and swallowing. Cognitive challenges such as memory lapses and impaired judgment become significant, alongside psychiatric conditions like depression, anxiety, or obsessive-compulsive behaviors. Ultimately, HD progresses to the point where individuals require full-time care. One of the most emotionally complex aspects of Huntington's disease is genetic testing. For individuals with a family history of HD, the decision to undergo predictive genetic testing can be deeply challenging. A positive result confirms that the individual will develop the disease, though it cannot predict the exact age of onset or disease severity. This knowledge can influence critical life decisions, such as family planning, career choices, and long-term financial planning. Many individuals struggle with the emotional burden of knowing they carry the gene, and some choose to forego testing to avoid the psychological distress associated with a positive result. When it comes to management, Huntington's disease presents unique challenges due to its multifaceted nature. While there is currently no cure, treatment focuses on alleviating symptoms and maintaining the highest possible quality of life. This requires a multidisciplinary approach, involving neurologists, psychiatrists, physical therapists, speech therapists, and social workers. For instance, medications like tetrabenazine can help reduce involuntary movements, while antidepressants and antipsychotics address mood and behavioral symptoms. Physical therapy can improve mobility, while speech and occupational therapy help patients maintain communication and daily functioning for as long as possible. In advanced stages, care often shifts toward addressing end-of-life considerations. This includes discussions about artificial feeding methods, ventilation support, and advanced directives. These decisions are particularly challenging as they require balancing the extension of life with maintaining quality of life. Families and caregivers frequently find these conversations emotionally exhausting, emphasizing the need for compassionate support from healthcare providers. Huntington's disease also raises unique ethical dilemmas, particularly regarding family planning. Many affected individuals worry about passing the mutation to their children. Advances in reproductive technology, such as pre-implantation genetic testing (PGT) combined with in vitro fertilization, allow at-risk couples to have children without passing on the gene mutation. However, these options are not universally accessible due to financial and logistical constraints. Moreover, the emotional weight of making such decisions can be overwhelming for many families. Research into Huntington's disease continues to offer hope. Studies are exploring potential therapies to slow disease progression or even prevent the onset of symptoms. While no breakthrough has yet transformed the standard of care, ongoing trials are investigating innovative approaches such as gene silencing therapies that aim to reduce the production of the harmful Huntington protein. For families living with HD, these advancements represent a beacon of hope for a future with better outcomes. Lastly, it's crucial to acknowledge the ripple effects of Huntington's disease on families. Beyond the physical and emotional toll on the patient, HD significantly impacts caregivers, who often face immense psychological and financial stress. Support groups and counseling services can provide vital assistance, helping families navigate the complexities of caregiving and decision-making. To summarize, Huntington's disease is more than just a neurological disorder. It's a deeply personal challenge that affects patients and their families in profound ways. While advancements in research and therapy offer hope, the current focus remains on providing compassionate and comprehensive care. Thank you for your attention, and I'm happy to answer any questions you may have.
That is the end of Part C. You now have 2 minutes to check your answers.